So today we are discussing about glossopharyngeal nerve. So glossopharyngeal nerve, it is the ninth cranial nerve. It consists of both sensory fibers as well as the motor fibers. Okay, the glossopharyngeal nerve is a ninth cranial nerve. It consists of both sensory fibers as well as the motor fibers. And the functional components of the glossopharyngeal nerve was, functional components are brachiomotor fibers, which supplies the stylopharyngeus muscle. Brachiomotor fibers which supplies the stylopharyngeus muscle. And preganglionic parasympathetic fibers. Preganglionic parasympathetic fibers to the otic ganglion. Preganglionic parasympathetic fibers to the otic ganglion. Okay, and also general somatic sensations from posterior one-third of the tongue, and also posterior one-third of the tongue, and also from the soft palate, tonsil, posterior one-third of the tongue, soft palate, tonsil, and also oropharynx. General somatic sensations from, okay, oropharynx. And special visceral sensation. Special visceral, nothing but the taste sensation. Special visceral sensations from posterior one-third of tongue as well as from valid papillae, and also general visual sensations act as chemoreceptors as well as baroreceptors. General visual sensations act as baroreceptors, chemoreceptors from carotid sinus as well as the carotid body. Okay, so these are the functional components of the glossopharyngeal nerve. One is brachiomotor fibers which supplies the stylopharyngeus muscle. Next one is preganglionic parasympathetic fibers which lay in the otic ganglion and to supply the and the postganglionic fibers, they supply the parotid gland. And the general traumatic sensations, they carry the taste sensations from, general sensations from the posterior one-third of the tongue, tonsil, soft palate, and also from the oropharynx. And also special visual sensation, nothing but the taste sensation from the circumvalid papilla as well as the posterior one-third of the tongue. Okay, and coming to the general visual sensations like baroreceptors and chemoreceptors from the carotid body as well as carotid sinus as well as from the carotid body. Okay, so these are the functional components of the glossopharyngeal nerve, and we know that the glossopharyngeal nerve is the nerve of the third arch. We know that we have discussed detailing about the pharyngeal arches. We learnt about glossopharyngeal nerve also in the development of pharyngeal arches. So the glossopharyngeal nerve, it is the nerve of third arch. Okay, and one more thing is the glossopharyngeal nerve, the tympanic branch of the glossopharyngeal nerve is considered as the pre-traumatic nerve of the second arch. We know that each mesodermal arch is supplied by one post-traumatic nerve and one pre-traumatic nerve. And the post-traumatic nerve is the glossopharyngeal nerve, and the pre-traumatic nerve is the tympanic nerve, which is the pre-traumatic nerve of the second arch. Okay, what is the pre-traumatic nerve of the first arch? It is the quadratympanic nerve, and the tympanic branch of the glossopharyngeal nerve is the pre-traumatic branch of the second arch. Okay, and coming to the nucleus, how the glossopharyngeal nerve arises. So it arises by 4 nuclei, which is the fibers of the glossopharyngeal nerve arises by 4 nuclei, which is situated in the medulla oblongata. So the inferior cerebrated nucleus, it gives preganglionic parasympathetic fibers, and the nucleus ambiguous, it gives brachiomotor fibers, and the solitary nucleus, it receives central processes of sensory neurons from the special visceral as well as the general visceral neurons. And this one, the spinal nucleus of trigeminal nerve. The spinal nucleus of trigeminal nerve, it receives the central process of neurons from which carries general somatic sensations. Okay, so the glossopharyngeal nerve arises by four nuclei. One is inferior salivary nucleus, which carries preganglionic parasympathetic fibers, which gives preganglionic parasympathetic fibers, and the second one is nucleus ambiguus, which gives brachiomotor fibers, and the third one is solitary nucleus, which gives special visceral as well as the general visceral sensations, which receives special visceral as well as the general visceral sensations, and the spinal nucleus of trigeminal nerve, which receives the central process of the neurons of the general somatic sensations. Okay, so by these four nuclei, the glossopharyngeal nerve arises from the medulla oblongata, and here it enters into the middle compartment of the jugular foramen, and here the glossopharyngeal nerve consists of two ganglion, superior ganglion and inferior ganglion. Inferior ganglion is comparatively larger and it is situated in the deep part of the petrous part of a triangular depression in the deep part of petrous part of temporal bone, and here this is the superior ganglion and this is the inferior ganglion. The glossopharyngeal nerve, it comes out. If the glossopharyngeal nerve, it comes out from the middle compartment of the jugular foramen, along with the 9th and 10th cranial nerves. Along with the 9th and 10th cranial nerves, the glossopharyngeal nerve also comes out. Okay. Along with the 9th and 10th, along with the 10th and 11th. The glossopharyngeal nerve itself is a 9th cranial nerve. So, along with the 10th and 11th cranial nerve, the glossopharyngeal nerve also comes out. So, in the jugular foramen, here it consists of two ganglion, superior ganglion, inferior ganglion. Superior ganglion is very small and doesn't give any branches, and the inferior ganglion here, it is comparatively larger and it's situated in the triangular depression on the deep part of the petrous part of temporal bone, and the glossopharyngeal nerve, it comes out. The glossopharyngeal nerve, it comes out to the middle compartment of the jugular foramen along with the 11th, 10th and 11th cranial nerve. It is surrounded by a separate layer of dura mater. It is surrounded by a separate layer of dura mater, and here the glossopharyngeal nerve, after coming out from the jugular foramen, here it descends along with the vagus nerve. It descends along with the vagus nerve. First it lies between the internal jugular vein. As well as the internal carotid artery. First it lies between the internal jugular vein and internal carotid artery, and then it lies between the internal carotid artery and external carotid artery. First it lies between the internal jugular vein and internal carotid artery, and then lies it between the internal carotid artery and the external carotid artery. Okay, here. So, the glossopharyngeal nerve, it runs downwards, it passes in between the internal jugular vein, internal carotid artery, and then it between the internal carotid artery and external carotid artery, and then here the glossopharyngeal nerve, it passes deep to the styloid process. It passes deep to the styloid process as well as the styloid groups of muscles. It passes deep to the styloid process as well as the styloid groups of muscle, and it passes deep to the stylopharyngeus muscle. It passes deep to the superficial part of stylopharyngeus muscle here and gives a tweak to the stylopharyngeus muscle, and then the glossopharyngeal nerve, it enters into the substance of the tongue. The glossopharyngeal nerve, it enters into the substance of the tongue. Okay. So, what are the branches given by the glossopharyngeal nerve? So, glossopharyngeal nerve, here it gives one important branch that is called tympanic branch. It gives one important branch that is called tympanic branch. So, this is the tympanic branch of glossopharyngeal nerve. This is the inferior ganglion of the glossopharyngeal nerve, and this is the tympanic branch of glossopharyngeal nerve. This tympanic branch, it forms tympanic plexus. We know that this is the middle ear cavity, that is nothing but the tympanic cavity. This is the tympanic cavity. So, the glossopharyngeal nerve, it forms tympanic plexus along with the similar branches of the vagus as well as from the superior cervical ganglion. So, the glossopharyngeal nerve, it forms tympanic plexus along with the sympathetic nerves as well as the vagus nerve in the middle ear cavity, and from the tympanic plexus, a branch arises from the tympanic plexus, that is nothing but the deep petrosal nerve. Nothing but the deep petrosal nerve. This tympanic plexus, from the tympanic plexus, what is the function of these tympanic plexus is the tympanic plexus is supplies the mucous membrane of the tympanic cavity, tympanic membrane, mastoid air cells and also mastoid anthem. The tympanic plexus, it supplies the mucous membrane of the tympanic cavity, tympanic membrane, mastoid air cells and also mastoid anthem. From the tympanic plexus, a branch arises which is nothing but the deep petrosal nerve which carries the preganglionic parasympathetic fibers and they relay in the otic ganglion. And also from the tympanic plexus, a communicating branch to the greater petrosal nerve, branch of facial nerve also arises. So from the tympanic plexus, deep petrosal nerve arises, and also from the tympanic plexus, a communicating branch, it communicates with the greater petrosal nerve of the facial nerve. Okay, and here the main branch from the tympanic plexus is the deep petrosal nerve, which relay in the otic ganglion, and through the auriculotemporal nerve, it supplies the parotid gland. This is the parotid gland. Okay, so that is the first branch. Tympanic branch is the first branch of the glossopharyngeal nerve, and also carotid branch. This is the carotid branch. This is the carotid branch. This carotid branch. So we know that the common carotid artery divides into external carotid as well as the internal carotid artery, right? So this is the external carotid artery and this is the internal carotid artery. So at the division of the external and internal carotid artery, we have carotid body as well as the carotid sinus is present. So the carotid nerve along with the similar branch from the vagus nerve, the carotid nerve along with the similar branch from the vagus nerve as well as from the sympathetic plexus, they form carotid nerves, and these carotid nerves, they supply the carotid body as well as the carotid sinus. We know that the fusiform dilatation, we call it as carotid body, is present at the bifurcation of the common carotid artery, and the carotid nerve from the glossopharyngeal nerve and the similar nerves from the vagus nerve as well as the sympathetic nerves, these constitute the carotid nerves, and they supply the they act as chemo as well as baroreceptor, which regulates the heart rate as well as the blood pressure. Okay, and one more important branch is the pharyngeal branch. This is the pharyngeal branch. Okay, this is the pharyngeal branch. So pharyngeal branch also, it forms a plexus with the vagus nerve as well as the sympathetic nerve. It forms a plexus with the vagus nerve as well as the sympathetic nerve and over the buccopharyngeal fascia, and it supplies the mucous membrane of the pharynx. It supplies the mucous membrane of the pharynx. Okay. And one more nerve is tweaked to the stylopharyngeus muscle. We have stylopharyngeus muscle arises from the styloid process. So a tweak to the stylopharyngeus muscle here. Stylopharyngeus muscle, it comes downwards. Okay, and also it supplies tonsillar branches. It gives tonsillar branches. What are tonsillar branches? They supply the tonsil as well as the soft palate. They supply the tonsil as well as soft palate, and also it supplies taste sensation to the valid papillae as well as the posterior 1/3 of the tongue. So these are the branches. So what are the branches from the glossopharyngeal nerve? One is tympanic branch. One is tympanic branch, which forms tympanic plexus. Yes, right? It forms tympanic plexus in the middle ear cavity along with the vagus as well as the sympathetic nerves. Okay. So tympanic plexus. From the tympanic plexus, deep petrosal nerve, tympanic cavity, so in the tympanic cavity, tympanic plexus is present. From the tympanic plexus, deep petrosal nerve arises. These deep petrosal nerve, which carries the preganglionic parasympathetic fibers and that relay in the otic ganglion, and the postganglionic fibers, they reach the parotid gland through auriculotemporal nerve. And the next branch is carotid branch. Next branch is this is the glossopharyngeal nerve, right? Next branch is the carotid branch, which descends downwards. So this carotid branch along with the similar branch of vagus as well as the sympathetic forms the carotid nerves, which act as chemo as well as baroreceptors. Chemoreceptor and baroreceptor, which regulates the heart rate as well as the blood pressure. So they supply the carotid body and carotid sinus. Okay, carotid body and carotid sinus. Carotid body and sinus. And the third branch is the muscular branch which supplies the stylopharyngeus muscle. Third branch is the muscular branch which supplies the stylopharyngeus muscle. Muscular branch here is the muscular branch. Third branch is the muscular branch which supplies the stylopharyngeus muscle. Muscular branch. And the fourth branch is the tonsillar branch. This tonsillar branch, it supplies the tonsil and it forms plexus along with the middle, tonsillar plexus with the middle as well as lesser palatine nerves. Lesser palatine nerves, and supplies the tonsil as well as the soft palate. Supplies the tonsil as well as the soft palate. Okay, na? Okay. It supplies the tonsil as well as the soft palate. And coming to the lingual branch. Coming to the lingual branch, the lingual branches are arranged in two sets, anterior set and posterior set. Anterior set and posterior set. The anterior set it supplies the valid papillae in front of the sulcus, and the posterior set it supplies the post-sulcal part of the tongue. It supplies the posterior sulcal part of the tongue which carries taste sensation as well as the general sensation. Okay, so anterior set and posterior set. Anterior set supplies the valid papilla and posterior set supplies the posterior 1/3 of the tongue. So these are the branches of the glossopharyngeal nerve. So the glossopharyngeal nerve gives off 1, 2, 3, 4, 5 branches. One is tympanic branch which forms the tympanic plexus, and the main branch is the deep petrosal nerve which carries preganglionic parasympathetic fibers, and the next one is the carotid branch which descends downwards and forms a plexus forming carotid nerves which supplies the carotid body as well as the carotid sinus along with the vagus nerve as well as from the sympathetic nerves. And third one is muscular branch which supplies the superficial branch which enters the muscle from its superficial surface, and the fourth one is tonsillar branch which supplies the tonsil as well as it forms a plexus with middle and lesser palatine nerves and supplies the soft palate also, and also the oropharynx, and also lingual branch. Lingual branch is divides into anterior set and posterior set. Anterior set supplies the valid papillae in front of the sulcus, and posterior set supplies the posterior part of the tongue, general sensation as well as the taste sensation. So that's about the branches of the glossopharyngeal nerve. So the glossopharyngeal nerve arises by 4 nuclei. One is nucleus ambiguus which carries the brachiomotor fibers which gives, and next one is inferior salivary nucleus which gives preganglionic parasympathetic fibers, and the next one is solitary nucleus which gives which receives central process of sensory neurons from the visceral, general visceral as well as the special visceral, and the spinal nucleus of trigeminal nerve which carries a central process of neurons from the somatic neurons, general somatic visceral neurons. Okay, so that's about the glossopharyngeal nerve, and the glossopharyngeal nerve it comes out from the middle compartment of the jugular foramen. It gives off these branches out, and they form tympanic plexuses, carotid plexus and pharyngeal plexuses also. And the glossopharyngeal nerve it gives another important branch, that is nothing but the pharyngeal branch, and it forms the plexus along with the vagus and the sympathetic nerves over the buccopharyngeal fascia and supplies the mucous membrane of the pharynx. It supplies the mucous membrane of the pharynx. So the spinal nucleus of trigeminal nerve it receives the central process of neurons which carries general somatic sensations. Okay, and solitary nucleus it receives both general visceral as well as special visceral, and nucleus ambiguus brachiomotor, and the inferior salivary nucleus preganglionic parasympathetic. So that's about the glossopharyngeal nerve which has both sensory as well as motor.